Hey guys, Tom Haverford here. This is a story set in Pawnee, Indiana with the characters from the TV show Parks and Rec. There are some familiar clinicians too, so watch and maybe you will learn a bit about our topic, the Dwyer osteotomy.
I'm Ron Swanson. I was forced to be in this film. I love bacon. That is all.
Hi Leslie. Remember me. It is Burt McClinton, FBI. Just kidding, it is indeed Dwyer, DPM, FACFAS.
Hello there, Andy. Of course I remember you. I just saw you 10 minutes ago at work.
It was 10 minutes ago. I could have sworn it was 7 years ago. Well anyways, I have some great news. After I received my degree from TUSPM, and then finished my podiatry residency, I decided to come back to Pawnee.
That's fantastic, Andy. It is about time that someone can fix my feet.
Glad I can help out. Please come to my office and we can get you all checked out. Dr. Dwyer just fixed my feet up, so glad Andy came back into town. Treat yourself 2016.
I hope he can do the same for me, Tom. Well, here goes nothing.
Welcome to my office, Leslie.
This is your office.
Oh yes, as cheap as we could get for this recon project. Only the finest for Dr. Mann.
Well, I hope this Dr. Mann taught you well, because I have had this nagging problem all my life. My feet have a very high arch and it only seems to be getting worse. I have gotten hammered and keep spraining my ankles. What is causing this, Doc?
Leslie, if there's one thing I know, Dr. Mann has taught me well. About the Red Sox and the Fighting Irish. I'm just kidding. He also taught me in detail about the exact issue that you have presented with today. It is called a cavus foot, or high arch foot type. It typically happens when the forefoot is plantar flexed on the rear foot. This can occur from many pathologies such as congenital club foot, neurological conditions like CMT, calcaneal fractures, and many more. There is a simple test I can perform. It is called the Coleman block test, where a block is placed under the lateral aspect of the varus foot. If the foot becomes rectus, there is no rear foot structural varus deformity, but a varus deformity caused by a plantar flexed first ray.
That makes so much sense now. So what can we do?
After the Coleman block test, which I just performed on you, it seems that you have rear foot varus deformity. We can proceed with conservative care for 6 months, then if that does not work we can talk about surgical options. For now, I'll refer you to Ron Swanson, our arts and crafts guy, our pet orthotist.
Leslie.
Ron.
Leslie.
Ron.
I picked the last possible job that you would interfere with me at. Why do I deserve this?
Because you were my friend.
Oh God, please stop. I was just covering for Dr. Palamarchuk. Just take your rear foot medial posted orthotics and leave me alone.
Andy, I have a question for you. That is Dr. Meyer to you.
Oh my God, not this again.
You insult my intelligence, Quasi.
Unbelievable, absolutely unbelievable.
Meh. Wow, Leslie, I cannot believe it has been 6 months since I have seen you.
Hey Dr. Dwyer, this pain in my heel has not gotten any better, even with conservative care.
Okay, Leslie, let's get you some x-rays. Usually, on a lateral x-ray, we see an increased mirror-ease angle, a decreased Tibbs angle, an increased calcaneal inclination angle, and a decreased talocalcaneal angle on a DP view.
So does that mean you can fix my heel?
With the information I've obtained both clinically and radiographically, I believe I have the solution to your problems. Oddly enough, my great-grandfather created the Dwyer osteotomy.
That's amazing. Good thing I came to a USPM instead of those kids in New York.
Oh man, I need to remember how to do it, Dwyer. I got to think back to Dr. Mann's class. I must go to my happy place. Hi there, Andy. OMG, Dr. Man, how did you get into my happy place? Because, Andy, you need my help on this procedure, don't you? Boy, do I ever. Okay, then let's start at the beginning. How is the procedure done? I cannot tell if your silence means you are going to answer it yourself or make me answer it. But if what I remember is correct, I will begin with a curved lateral incision through skin, superficial fascia, and deep fascia to expose the peroneus longus tendon. I will then retract the peroneus longus tendon and incise down to bone through the periosteum. Then I will make a lateral wedge, about 8 to 12 millimeters wide, in the calcaneus. This wedge will break through the medial cortex. Once the wedge is removed, I will close the gap by dorsiflexing the forefoot and put the heel into a slightly valgus position. My silence is my greatest weapon, Andy. You are doing a great job remembering thus far. But always remember that I will love the Red Sox more than anything. So how will you fixate the closing base wedge? Rigid fixation is necessary in this surgery. I could use cantilevered screws perpendicular to the osteotomy, preferably 2 instead of 1, or I could use Steinman pins, or bone staples from McGlamry's text. One does not simply say McGlamry's text without the usage of my name in the same breath. Of course, Dr. Mann, you are the king. So then what is next for the patient? Well, sir, you said in podiatry today that the patient must be in a cast for 8 to 10 weeks, with the first 8 weeks being non-weight bearing. However, some doctors begin weight bearing around the 6-week mark in a progressive manner with a cam boot, then in normal footwear. X-rays should be performed at the 6-week mark regardless to determine if there's bony fusion of the osteotomy. I guess you really did listen in my recon class, Andy. However, it looks like you have been busy lately. Why do you say that? Because you clearly do not have time to use a razor. So then, Andy, finally, what are some complications that one could have from a Dwyer osteotomy? Some complications include non-union, malunion, infection, damage to soft tissue structures, sural nerve damage or entrapment, collapse of the foot from excessive pronation, dorsal migration of the proximal fragment, improper fixation, or hardware failure, and lastly recurrence of the deformity. Wow, look at you, you really are a TUSPM all-star. Well, it looks like my work here is done. Good luck with the procedure. What a strange and oddly lifelike dream. Well, it's time for Leslie's surgery. Good thing I learned everything to prepare for this day.